My name is Savon Holland. Today, I'll present on how resistance training affects metabolism and body composition in older adults. As we age, we often experience a decline in muscle mass and an increase in body, particularly around the abdomen. These changes not only affect appearance, but can lead to serious metabolic health issues such as type 2 diabetes, cardiovascular disease, and metabolic syndrome. Resistance training is a key intervention that may help reverse these age-related changes. So I'll summarize two recent studies, discuss their findings, and explain practical takeaways that can be applied to exercise programs. So as people age, muscle mass decreases, a process known as sarcopenia, while fat mass, especially visceral fat, tends to increase. This combination slows metabolism and increases the risk of chronic disease. Resistance training can help counteract these effects by stimulating muscle growth, increasing energy expenditure, and improving metabolic function. Maintaining a healthy body composition helps older adults not only live longer but also maintain independence and perform daily activities more effectively. Understanding how resistance training affects metabolism and fat distribution is critical for designing effective exercise programs for this population. All right, so this study explored how different frequencies of resistance training affect body composition and metabolic health in older adults aged 65 to 75. 92 healthy participants were randomized into groups performing training 1, 2, or 3 times per week, as well as non-training control group for 6 months. The researchers measured fat mass, lean mass, and blood markers like HDL, LDL, and inflammatory indicators. They found that all resistance training groups reduced total and abdominal fat and increased HDL cholesterol, while higher frequencies produced slightly greater fat loss. Even single sessions per week offered measurable benefits. This suggests that even low to moderate levels of training can be meaningful, can improve metabolic health in older adults. All right, so the second study examines older overweight or obese adults ages 65 to 79 with metabolic syndrome. So participants were randomized to either resistance training alone or resistance training combined with caloric restriction for 5 months. The training was moderate intensity, 3 days per week. The combination group lost about 5.7% of body fat and showed significant improvements in triglycerides, blood pressure, and metabolic syndrome criteria. Whereas the resistance training only group had minimal weight loss or metabolic improvements. This study highlights that diet can enhance the effects of resistance training, especially for those who are overweight or have metabolic syndrome, and emphasizes the synergistic effect of combining exercise with nutrition interventions. Together, these studies provide a clear message. Resistance training improves body composition and metabolic health in older adults. Fat mass decreases, especially abdominal fat, and lean mass is preserved or slightly increased. Training frequency matters, but even 1 to 2 sessions per week can provide meaningful benefits. When resistance training is combined with caloric restriction, improvements are amplified, especially for weight loss and metabolic syndrome markers. So notably, individuals with poor baseline metabolic health tend to benefit more, suggesting that personalized exercise programs may be most effective. This synthesis helps us design targeted interventions. So based on these studies, practical recommendations for older adults include training 2 to 3 times per week at moderate to high intensity, targeting major muscle groups with multi-joint exercises. For overweight or obese individuals, combining resistance training with moderate caloric restriction and adequate protein intake may further improve composition and metabolic outcomes. Gradual progression and allowing for sufficient recovery are essential to minimize injury risks. These strategies not only but also maintain independence. Also improves quality of life and reduce the risk of chronic diseases commonly associated with aging. All right, so while these studies prove valuable insights, they have limitations. So most were relatively short, lasting only 5 to 6 months. So long-term sustainability and maintenance of benefits remain unclear. Gains in lean mass were modest, likely due to anabolic resistance in older adults. Glycemic improvements were inconsistent unless dietary interventions were included. Um, Future research should explore optimal protein intake and individualized training programs and long-term adherence strategies. Also, in resistance training and other lifestyle factors will help refine recommendations for improving metabolism and body composition in adults. All right, so these were the two main studies analyzed in this presentation. The first by Inhalinen highlights resistance training frequency on body composition and metabolic markers. The second by Normandin shows the additional benefits of combining resistance training with caloric restriction in older adults with metabolic syndrome. Both studies emphasize the importance of resistance training and diet for improving metabolic health and reduced fat mass in aging populations.